And then when you start looking at some statistics and numbers and look for what do we know about gender, or how can we look at gender differences in HIV, and these are the kind of graphs that you come up with. So basically, there's no differentiation between all the different grades of genders. What you find are differences between men and women. So those are the kind of numbers that we typically throw out at or use for developing next generation of treatments, cures, treatment cascades. Those are all dependent on these numbers. So here's an example, but even with these numbers, which are very simple numbers, men and women, you can see that in places like Africa, and this was taken from CDC in 2010 numbers, you can see that the top bars are white MSM, or sorry, this is actually CDC in United States. I think I switched slides this morning. But you can see a little bit more gradation in terms of the numbers that are there. So these are new HIV infections in United States from 2010. And you can see white MSM, black MSM, second category, Hispanic, Latino MSM, and then black heterosexual women. So you can see different categories of prevalence in new HIV infections, which is very prototypical of North America, where it's still majority is in MSM. And the new numbers show that it's also increasing in immigrant populations, especially here in Ontario. So that's the kind of numbers that at least you have some idea of, sexual identities of people and sort of broad biological differences according to sex. But then you go to places like Africa, and these are numbers from 2011 in Southern Africa, and these are reproductive aged adults. And you see the differences, and you can basically see men, women, simple categories, and you can see that even with these simple categories, you can see the high numbers of prevalence in women, hovering around 30% in many of the Southern African countries. And compared to that, the numbers in men look less, but if you consider what they are compared to North America, these are very high numbers. So basically 20 to 25% prevalence in men and about 30% in women. And these are for places where we have numbers. I had to search around to find any data for transgender. So you can see how difficult an issue it is. To find and how to help and how to develop treatment cascades for people who don't identify with one or simple genders or simple male or female sex. This is from CDC from 2013, November 2013. And what the CDC says is that transgender communities in US are among high groups for HIV. Even in US, the data is not uniformly collected. So there's no accurate information that's available. From the data collected, they find that the transgender people have higher prevalence compared to any other category. What's startling is that the people who are transgender women in particular have about 50-fold higher risk of contracting HIV. This is a CDC information sheet. If you have time, I suggest you take a look at it, but the numbers are pretty startling, and it's mind-boggling that we shouldn't be looking more into it. And I think there are attempts going on, but clearly this is one of the most at-risk population, even in North America. So, when I was thinking about this, coming from a basic science perspective, I was thinking mostly of biological sex. So here's sort of my simple list. I'm sure this is in no way a complete comprehensive list, but I was thinking of what do I know about HIV, immunology, virology, and how does being a man or a woman make a difference between how your risks are, what your susceptibility is, what your treatment is, and it's completely different. So it's not a little bit different, it's completely different. So here's, just sort of a very basic list. I highlighted in green some of the topics that are going to be covered during the day today at various talks. So increased biological susceptibility among women, that's all numbers show that. Sexual violence, not to say that men are not victims of sexual violence, but in so many conflict zones around the world, women and children are primarily the target for sexual violence. Pregnancy increases susceptibility. Mother-to-child transmission issues are very specific to women. We know now that there are, what we had worried about, that there may be menstrual cycle differences as well in susceptibility. There's a lot more studies that are going on now, and we think that this may be a really good way of dealing with some of the issues around HIV susceptibilities, to understand the vaginal microbiome and our own bacteria that can fight off these exogenous pathogens or pathogens like HIV that come from outside. And my own lab works in the hormonal contraceptive issues around that may enhance risk, and you'll hear some of those talks today. And ART use in pregnancy, which Lena's sitting here, and I think her lab does a lot of work in that. I'm going to give you an example of something very simple, how even viral loads differ between men and women. And chronic immune activation, which affects your lifestyle and how long you live and how quickly you develop AIDS, differs between men and women. And on the bottom part is the list that I could think of in terms of differences, biological differences making a difference to men. There's a higher risk in MSM compared to most other categories of sexual transmission. Circumcision decreases susceptibility, so a bit of good news there. Semen microenvironment compartmentalization, I'm sure Rupert will talk about that later today. There's a specific talk on male and gender factors. Viral reservoirs in testes. I think Reina Bendayan is here, and her lab does work on this aspect. Effect of HIV and ART on testosterone. So there's definite issues with ART on testosterone levels in men. And finally, I'll end with a slide to talk about those basic differences. So here's a very complicated looking immunological slide, but what it basically shows on the left side is how women respond to HIV, and on the right side is how men respond to HIV. And this is a cumulative research that has come pointing out to some very basic differences. And what's shown on the top is HIV and how cells, the same cell in a woman versus a man, responds differently. And on the left, you'll see lots of green dots. That's interferon. So that's the first antiviral protein that the cells make when they see HIV. And as you can see, in women, that's a very big, profound response. The result of that is that in acute HIV infection, women actually have lower viral loads. They have higher CD4 counts. Unfortunately, that's also a bad part because of these inflammatory proteins that are made in higher amounts, women fare worse in the chronic HIV infection part, where they actually have higher immune activation. So clearly there are gender differences starting from very basic first step of the body recognizing HIV. And you'll hear those talks through the whole day today.